We're also recording this just so everyone is aware. Okay, well, welcome everyone to today's discussion, which is part of our week of action. Today we are talking about equity in healthcare for the queer community. We have some incredible and very thoughtful folks who I am self-declaring experts on this topic. All of them bring different but related perspectives to the table. I'm going to give them all a moment to speak and give us an intro to their thoughts about the subject. And then this is going to really function like a dialogue. As I said, if anybody wants to say anything, just use the raise your hand function and or comment in the chat box, and we will add you into the conversation. I'm also going to be watching our comments on Facebook, and we'll let our folks chatting about anything that comes up there. My name is Patrick Dunn. I'm the Executive Director of the New Haven Pride Center. As I mentioned, this is part of our Week of Action, which is a week-long series of events that are geared towards creating action and remembering that Pride started as a protest. So this whole week we've been engaging in all kinds of conversations and topics. If you want more information, there's a lot of it at newhavenpridecenter.org. And without further ado, I'm going to introduce our folks that are speaking. I'm not going to call you panelists, our experts. And I'm just going to go in the order that you appear on my screen. So I apologize if it's not the same as yours. Zoom is not always my friend. So I'm going to start with Layne, because you seem to be the first person on my end.
How did I know it would be me first? Hey everyone, my name is Layne Gianakos. My pronouns are he, him, and his. I'm really excited to be here. Equity in healthcare for LGBTQ people is something I'm hugely passionate about. Some of my background, I've been working at Anchor Health Initiative for almost 3 years now. We are a nonprofit LGBTQ primary care clinic with 2 offices. One is in Hamden and one is in Stamford, but we see people across the entire state. We see some people from other states too. So I've really been there pretty much since the organization began, and just seeing it grow has been amazing. So I'm prepared to talk about some of the things that I've seen there. I oversee our case management program, so I'm going to be talking a lot about the other types of care that we provide as people who want to get good care to LGBTQ people across the spectrum, not just physical care. So that's a little bit about me, and I'm happy to be here. Thanks.
Thank you, Layne. Next, I'm going to go to Gretchen.
Hey y'all, this is Gretchen Raffa from Planned Parenthood of Southern New England, pronoun she, her, and I'm very excited. Thank you, Patrick, for inviting me to be part of this conversation. Most of my role is as an advocate and someone that focuses on policy around sexual and reproductive health care. So I also represent Planned Parenthood Votes Connecticut, which is the advocacy and political arm of Planned Parenthood. And I am also part of the 1 in 5 women in this country that have relied on Planned Parenthood for my sexual and reproductive health care. Planned Parenthood has been there for me my entire adult life. I've been a patient at Planned Parenthood for over 20 years, and started seeking care when, I didn't have access. I was uninsured and needed access to high quality, affordable health care. And I haven't left since because as a queer woman, I trust my clinicians and health center staff to provide compassionate, non-judgmental sexual and reproductive health care. And so it's not only my professional work, but also personally important to me, because as we know, and everyone that's part of this conversation, is that LGBTQ plus people's reproductive health care needs often go unmet because of the system that has traditionally marginalized our community and reproductive health care overall. And, in addition to high rates of stress due to systemic harassment and discrimination, which has been shown to impact people's physical and mental health, LGBTQ plus people face lower rates of health insurance coverage and higher rates of certain types of cancer and HIV and AIDS. So I'm proud to be here representing Planned Parenthood as we continue to honor and the resilience of the LGBTQ plus community who continue to face just unconscionable attacks on our bodily autonomy and access to healthcare and our very humanity. So, you know, I'm again excited to be a part of this, and I always remind folks that the fights for LGBTQ plus rights, reproductive rights, and racial justice are inextricably linked. And what we are seeing in this country right now is just more important than ever to talk about the public health crisis that is racism as well. So I'll pause for now.
Thank you so much, Gretchen. Next, we're going to go to Alex.
Hey, my name is Reverend Alexander Garbara. Expert, I guess you could call me a prosumer for health. I've been HIV positive for about 40 years. My viral bloom was in 1980 when I was in graduate school for psychology. So it's been a long road in the trenches, in the intersection of poverty, health, and disparities. I guess I'm the first founding member of the Pride Center, and I remember being on the first board. LGBTQ health was really something that we always really wanted to get into, but we were never successful at that. So I really want to thank Patrick for bringing such leadership to this table and making things happen. HIV has revealed disparities in healthcare for both queer people and race, the same way COVID is doing now. But now it's a big thing with COVID, but these disparities have been existing for quite a while. So it's time to address them. And we have to look at the intersection of poverty, race, and health. Unfortunately, the policies we have in Connecticut keep people suppressed in cycles of intergenerational poverty. I've been trying to fight that for 10 years now by expanding access to care and treatment, because if we had more access to eligibility and treatment, we could actually help reduce HIV infections significantly, almost zero, because when you're in treatment, you cannot transmit the virus. This is also a really good thing for people with HIV because it feels good not to be able to be infectious. The first time in life, people feel like they aren't pariah or a disease or something that has to be transmitted. So it's very good for the people who are on treatment. It's very good for society that we can actually reduce new infections. I'm not sure why there's been such resistance in Connecticut to expand access and eligibility to these programs that really are effective, but it's happening. So I think it's time to say enough is enough.
Thank you, Alex. And now we're going to go to Jerimarie.
Hi, this is Jerimarie Liesegang. I'm a non-operative trans woman. I prefer they, but having transitioned in the early 80s and working for a large conservative insurance company in the 80s, late 80s, they didn't have boxes for anything else but he and she. So, I'm used to being called she also. But my affiliations are, I'm a board member with the Hartford Gay and Lesbian Health Collective. I've been on the board several times with them. And so this is my next round with the Health Collective. I also am the founder of Connecticut Trans Advocacy back in the, when was it? In the 90s, I think. And was the executive director for many, many years until I finally stepped down and retired. About the Health Collective. The Health Collective, well, one thing I'm going to back up is, sort of talking about health inequities for the community, LGBTQ community, is kind of like throwing a stone into the ocean and the likelihood of hitting water. It's ubiquitous, and unfortunately, and I would say as a trans person, and I know Layne will also definitely say this, is that, trans community really suffers severely in health inequities. I know I do a lot of work with the Hartford community, and it's just very, very typical and very heartbreaking. And most of them live in life of poverty, et cetera, et cetera. But it's true, just as Alex said, HIV, going through poverty, things like that, we all suffer with that. But anyway, I blab on. I'll try to be quick. Health Collective does a lot of work. It does dental services. It does medical services for the community. It's highly inclusive. Linda Estabrook is the executive director since 1989. I don't know how she continues to do it, but she does an amazing job with the collective. She's just a phenomenal woman. I used to be on a zillion boards. I'm only on one board now, and that was the Health Collective, because I've been so impressed with what Linda does with that Health Collective. I want to contribute as ever I can. And also, it's amazing what Linda's doing in the Health Collective around COVID. They've got like these bubble suits they ordered, and they just really are going to every extent of protection. Anybody who knows Linda knows she wouldn't do anything easily or quickly. And you know, the fact they did their first vaccine, they did it out in the parking lot. So they really are trying, because we know with COVID, access to healthcare is even worse than it's ever been. A little history of the collective is it started in the 80s, and Alex, you probably know a lot more about this than I do. It started in the 80s, grew out of some other organizations, and then Linda in '89 took it over. But it was, you know, one of the few places, if the only, you know, one of the few places you go to if you had HIV/AIDS in Connecticut. And we know that HIV/AIDS spread up through from New York City along sort of the I-95 corridor, and then spread out throughout Connecticut. And so there's been, you know, we see places in New Haven, Hartford, et cetera, that really are looking at that. Sean does phenomenal work in that area. And also, importantly, in the 90s, they actually did dental for HIV/AIDS, which was not available before. At least I know, Alex, correct me if I'm wrong on that. But they had not done HIV, you know, dental was not done for HIV, so it gave them access to that. So in summary, really, Health Collective has been a primary resource for HIV/AIDS and has been always very safe environment, listening environment, etc. I will jump very quickly to trans, because I can't talk without talking about trans issues. And Linda and I created one thing we found is health and disparities and legal disparities for the trans community. Because the one thing is health and legal are tied like that. I mean, they're like intricately tied, unfortunately, due to the medical constraints, whether you like them or not, and due to the legal constraints. And so anyway, we created Transgender Lives, which is the intersection of health and law conference. And that was important because it provided a safe space for people in the Northeast to come together. Philly had a phenomenal health conference, and we really replicated that in Connecticut. And I'll sort of stop there. I won't go on with any more blab on, but if anybody has any questions, I'd be more glad to answer them. Thank you very, very much. And thank you, Patrick, for the opportunity.
Thank you, Jerimarie. And finally, we're going to go to Dr. A.C. Demidont.
Hello. Let's see. I'm A.C. Demidont. I'm an infectious diseases doctor by training. I use she, her pronouns. I came to Connecticut about 6 years ago and spent the past 5 years founding and growing Anchor Health Initiative from like me with a computer and a cell phone in a closet in the New Haven Department of Public Health to, you know, what it is now, which is, you know, 2 offices and a pharmacy and lots of providers. And you know, prior to coming to Connecticut, I worked at Callan Lord, and I felt like it doesn't make sense to me that people have to drive from New Haven to New York City or Boston to get healthcare. And so why can't like we create that here? And I think a lot of people had that idea, but they didn't like, I don't know, you know, so we did it. And I recently decided that I needed a little break from a lot of things in life. And so I now, well, I sat on the Getting to Zero Commission for Connecticut. I wrote the report. I was one of the people who wrote the report. My main section was on PrEP. I've been working on PrEP and PEP since 2009. And so I transitioned now to, I work as the principal medical scientist for New England for HIV prevention for Gilead. So I, well, most of my time now is spent on COVID, to be completely honest, because Gilead makes remdesivir. So it is, but you know, I look at health equity from, so my career has gone like this. Like I could do it on an individual patient basis to be like the one person that little like 13-year-old or 12-year-old trans girl who's like stealing her mother's credit cards to buy hormones on the internet. Like that's like a real story, right? Like that I could be there to be that person's doctor, to being like creating a health system, to now like getting to do it on a more like global kind of impact, and do it in a way that, you know, and at a company, to be honest, that is, I have just on my team, I have 4 transgender people. So, you know, it is an inclusive organization. They have done studies with transgender people. And, you know, everybody can say what they want about Big Pharma, and they're probably right. But the fact is that, you know, I still am on the board of directors of Anchor Health Initiative, and will most likely at very, very soon be coming back to like volunteering to volunteer to see patients, because like I do love patients and I miss my patients, right? So it's been a complex journey for me of how to get, but the literally, if you ask anybody who knows me, the sole focus of everything that I have done is to make sure that LGBTQ people have equity within healthcare. Whether it was me showing up to my first day of infectious disease fellowship with a blonde mohawk and like, like a purple like cape, to the on like my individual health, that gives us health equity when we show up as our authentic self in a medical space. And it's hard in 1998 to do that, right? Like, so everything that I've ever done, written, researched, is about making sure that we get the healthcare we deserve. And so we don't still. And the last thing that we do at Anchor Health Initiative, that was my main, I had two goals: to create that, and then to create a space where I could bring young, new medical providers to come and train in a system where they would learn how to take care of queer people, so that it wasn't like they just went to like regular, because if you go to regular sort of like NP school, medical school, you get like zero training on how to take care of queer people. So, we do that, and we're really grateful to have relationships with a lot of the universities around in Connecticut to have their students come and learn from us. So that's what I can do for health equity right now. So yeah, that's pretty cool.
Thank you, AC. So I'm gonna mostly just allow you all to chat, but I have some prompts. I do want to jump off of some positive things that have already been said, because I think let's start the conversation in what we have done well or what we have achieved, and then we can dive into the challenges and trends and attacks and all of the other not so good things that health equity is experiencing. So I wanted to start off by just saying, what are some of the things that, AC, obviously you talked about Anchor, as did you, Layne. Jerimarie, you talked about the Health Collective. Gretchen, you spoke about Planned Parenthood. We do have, in Connecticut, we're very fortunate to have healthcare organizations that prioritize the queer community. What are some of the kind of positive things that you see about happening specific to Connecticut healthcare equity for LGBTQ people? And we're going to popcorn this, so feel free to jump in. Don't go in order.
Well, I mean, on paper, Connecticut is great, right? Like on paper, Connecticut, for at least for transgender people, Connecticut is great, right? Like things are covered that aren't, hormone surgeries that aren't covered in other states. And, it's one of the most, we can get the most services of all. The problem is that we don't have any providers who actually like do the service in Connecticut who take, the Medicaid. So, we've had to fight like to get out of state coverage for procedures. So, I think that at least like on paper, we're good, and protections are pretty good around trans people and people with HIV too. We're fairly protected. So, we're lucky, right? Like, there were only 13 states in the United States where that Medicaid covers hormones, right? Like, people don't understand, like, you look at a map, like the majority of the middle of the country and the South, nothing is covered. So, and I started practicing at a time when nothing was covered. So that's a good thing, I think. Like, our insurance, it's not perfect, but it's better than most places. It's like we're like a destination state for transgender people, because we can the services that they need to live, right? Like, I don't need to give you a pill to make you gay, but I oftentimes have to do some kind of medical intervention to affirm your gender identity. And so it's, having medical insurance is a vital part of being a transgender person and as happy as you possibly can be transgender person. So that's good for Connecticut, right?
So I'd like to add to that is, is it okay? It's okay to add? I'm sorry.
Oh yeah, go ahead.
Okay, good. Were you going to talk, Layne? Is it so? You go first.
I'll go after you.
No, I want you to go first because you deal with it more recently. I was going to talk. Well, I go real quick.
I was just going to say, talking about our state insurance, the other good thing in Connecticut is it's pretty easy to qualify for state insurance compared to other states. There are a lot of states that even if you are uninsured and you have very low income, you don't qualify for health insurance unless you're a pregnant cisgender woman, for example, in Texas. So the fact that more people are able to access the state insurance in Connecticut is a huge part of equity fund healthcare. And then the fact that it then does cover things like PrEP, PEP, hormones, surgery. We're pretty lucky in Connecticut in terms of what our state Medicaid offers and how expansive it is.
I'll talk to it from a historical perspective because I was working with trans community back in the 90s. And then it was like Medicaid. We had one trans person, they refused to give her travel to the doctor's office because it wasn't covered. Because they used, I forget who the hell that damn senator was that put that damned amendment in way back when on Medicare, but it was just ridiculous and things. But anyway, and I remember we did legislation, and Gretchen, you know this because you were a big advocate for that. And I remember when we raised the gender identity bill in the House, in Congress, CGA, the first year we raised it, legislators didn't know what to say. They had no idea what terms to use, how to talk about the community, etc. And we spent 9 years really educating them in Connecticut. So I will say we've come a long way. And so I will say on a positive side, we have definitely, especially from a trans community, this state is phenomenal. It's very, very good. But I will say, and I don't, Layne and AC and others, I defer to you all, but I know when I was closer, because I'm dealing with cancer now, so I haven't really been focusing on the community, is what I realized was, though, it's still hit or miss. And what I found, like when I joined the 20 Club, which was a transsexual peer society, which was very elitist, the only people there were white people, white males who were transitioning because it was word of mouth. They only heard about it. And even today, I think it's still the same. Or you take Hartford, take New Haven. There's a lot of trans people who are just surviving to exist, and they don't know about a lot of these services. They don't know access, but that's why it's good. And we do like the HIV community did ages ago within each of the centers, because Connecticut is a small state, but as AC said, we need New Haven, we need Hartford, we need Bridgeport, we need Danbury, we need all the urban areas to really be providing these services so they can reach out into the community. So anyway, I'll just stop there.
So I'm just going to say this, and COVID, this like disrupted, so this idea of disruptive innovation, telehealth is the silver bullet for transgender people in my mind, because it allows me to peek into your organization from the comfort of my home and see whether you're like trans competent or transphobic before I even like step in there. And I think the lobbying already, I've already been lobbying with some of the legislators, and if you guys, I would suggest you do it as well, that they not go back to not paying for telehealth visits, because they didn't pay for them before. Because for transgender people, it is having that first look at you and getting that first conversation is so telling. Like, I can tell whether I'm never coming back to you within like 10 seconds of an appointment, right? So telehealth, I think, could be like change some of what you were talking about. So it'll be interesting to see what happens with that.
I think,
Oh, go ahead.
like Patrick said, we do have these great pockets, including Dr. Blick, Healthcare Advocates Initiative, and things like the Ryan White program in New Haven. In New Haven, we have almost a 90% viral suppression rate, which means that if you're suppressed, you can't transmit the virus. And I think it wasn't for these programs and people like Dr. Black and AC, who was one of the best advocates I've ever had as a physician, I wouldn't be alive today. Seriously, I would not be alive today if it wasn't for these support systems and mentors and who gave me hope to do the craziest stuff that we've done over the years, clinical trials. So we have those pockets. Now we just need to bring them together and make people aware of them and include them to more people. So that's what we're doing, right? And yeah, I wouldn't be alive today if it wasn't for them.
This is Gretchen. I just want to echo what folks have all lifted up, and thank you, AC, for lifting up the importance of telehealth, because I think that's what we're also seeing in the COVID crisis, how important access to healthcare providers through telehealth, but that also is an equity issue if people don't have access to internet, et cetera. So thinking about how we can improve, make permanent changes to telehealth laws and policy is one of our top priorities moving forward as an organization. And the other thing I wanted to lift up too in terms of positives around our Medicaid program is we also have an expanded, it's a limited benefit program, but for people that are seeking what's called family planning services in the Medicaid definition, but preventative healthcare services like hormones, cancer screenings, there's a higher income eligibility rate for those limited services. And that's a really important Medicaid program that allows people that might not hit the eligibility threshold for full Medicaid to at least be able to access some sexual and reproductive health care services, including hormone therapy, et cetera. And I think that brings in another piece of the positives on the policy side, because that's what I focus on, is that last year the state of Connecticut was the first state to do this through the legislative process, put into our state budget and established an LGBTQ plus health and human services network. And we're in the beginning phases of what that network will do, but the reason we worked so hard on getting that passed and getting money allocated was to give us the ability in the state to do a statewide needs assessment, and putting money behind that so that we could actually do a full scope statewide healthcare needs assessment. And what I'm excited about is the opportunities that we might get to learn from that assessment. There are some challenges, obviously, doing a needs assessment in the time of COVID and social distancing, and reaching the most marginalized in our community is obviously top of mind for us. But what our hope is, as well as what we learned from this and what the network can continue to do, because this is now established in state statute, is that we can provide recommendations to the State General Assembly for policy proposals and recommendations to improve the health and human services for the LGBTQ plus community in Connecticut. And I know policy is just one piece of addressing inequity in healthcare access, so I also want to name that. But that was a big win last year, and I think as advocates and healthcare providers, we have an opportunity to have the General Assembly and the legislature's ear in really lifting up what we all see as providers and as advocates in our communities every day to state government to, again, better inform policy from the people that are most impacted by healthcare inequity.
And we've spent a lot of time talking about the state Medicaid and how it is really great for people who have it, but for all the people in Connecticut who don't have it, they still face a lot of these inequalities, and still they don't meet the threshold to qualify for state Medicaid, but hormones out of pocket can still be $300 a month. And that's just the hormones. Talk about the lab work, talk about the office visit. The most recent data that we have comes from a study that was published in 2016, the National Transgender Discrimination Survey. And to date, it's the largest survey that's ever been done of trans experiences. And luckily for us, they actually broke it down to state by state, and we have data for that. And they surveyed people over the course of the year 2015 25% of respondents in the state of Connecticut said that they avoided medical care when they needed it because they couldn't afford it. So this is still happening. And I think that sometimes we look to the positives in Connecticut, forgetting that there are these pockets of people that still aren't accessing the services they need. And we say, you know, we're a pretty progressive state and we have these big healthcare organizations across the state. We have Yale, but I know that trans people in particular, but LGBTQ people across the spectrum and HIV positive individuals are facing discrimination at these facilities because I see it every week. You know, it's crazy to me that in the year 2020, I would have to call a neurologist's office at a major facility in the state of Connecticut to tell them, someone we're referring to you as trans, please don't misgender him when he makes an appointment. The fact that you have to do that is still crazy to me. And how many doctors' offices are there where they don't have somebody in the office who is going to call first, who is going to say, this is a trans person, please affirm their gender when they go. And this is why a lot of trans people in particular avoid going to the doctor when they really need to. It's out of that fear, and it's not this, you know, sort of paranoid thing. That fear is very much founded in reality. 29% of people in Connecticut in that same survey reported at least one negative experience with a healthcare provider just in that past year. And that's a huge number. That's 29%. The national average by comparison was 33%. So we're not that much far off from the national averages. And that's something that we need to address in the state of Connecticut. You know, why is it still happening that people are being denied services, people are being mistreated by their medical providers, people aren't seeking medical care when they need it because those things are happening? And what does this recent ruling have, how will it impact this reality, which we're already facing? So I also want us to talk about that, if we can, sort of that policy and what that's going to mean, especially in a state like Connecticut.
Roll with it, Layne. Keep going if you want to talk about it.
Right. We're lucky in Connecticut that we have very good protections, you know, for LGBTQ people accessing healthcare. So for people that don't know what I'm talking about, the federal administration recently finalized a rule that could potentially make it so that healthcare providers can refuse to provide care to LGBTQ people because of their personal religion, their personal feelings. And it has more of an impact on trans people because what they're doing is they've actually changed the federal definition of sex and gender, effectively rendering trans people invisible. And that's how this discrimination is going to happen. So if a transgender woman goes to the doctor now, technically, according to the federal government, they could see that person as male, and they can deny certain services and coverage for those services based on that. And in Connecticut, I don't think that we'll see a lot of that. We do have really strong state protections in place, but that doesn't change the fact that this ruling got a lot of noise, it got a lot of attention, and the way that I see it, it's really intended to bully and intimidate people from accessing healthcare, even in places in states where they totally do have the right to access it. It's building and capitalizing on this fear that has already been there, this very deep-seated, very real fear. So now it's, where do we go from here? What are we going to do as advocates, as people in the community, as healthcare providers, to let the residents of Connecticut know we're not going to tolerate that here, and they can still access life-saving and important medical care?
Does anybody else want to talk on that?
Yeah, I think I will just echo again what Layne was saying, is that this is just, you know, another in a series of threats and attacks on the rights and the freedom of LGBTQ plus people. The Trump-Pence administration has been, you know, using their executive power, the executive branch, well, and Congress, I shouldn't say it's just the executive branch, but this rulemaking process that the Trump-Pence administration, and I always say Pence too, because I believe that he's behind a lot of these attacks, but I think that that's the thing that we have to keep remembering, is that it's really about instilling fear and continuously targeting the LGBTQ plus community. And I also wanted to lift up, you know, that rule is amongst a long list of rules that is threatening access to a full range of sexual and reproductive health and rights. And I won't go through them all, but I did want to lift up something in particular, because when we think about access, especially for people that are shut out of healthcare insurance programs, whether it's private insurance or public programs like Medicaid, one of the most harmful things that has happened recently from the Trump-Pence administration is the domestic gag rule that was an executive order. And what that did was bar providers in the Title X program, which is the only federal funding program that goes to affordable birth control and sexual and reproductive health care. You know, this gag rule that he did was to specifically target Planned Parenthood, because what it will do is bar abortion providers from taking Title X funding. And I'm bringing this up in the context of LGBTQ health equity, because we know for LGBTQ plus folks that rely on Planned Parenthood for their health care, for people that don't qualify for Medicaid or don't have private insurance, it is programs like the Title X program that allows providers like Planned Parenthood to provide care on a sliding fee scale at zero cost if people don't have an income. And when people are coming in for STD testing, you know, hormones, birth control, cancer screenings, you know, these programs are a safety net program for people that don't have full access to private and public health insurance. And so this rule forced Planned Parenthood out of the Title X program last August, and that meant $2.1 million that didn't come into the state to help ensure that, you know, the 42,000 patients that were, you know, that were benefiting from the Title X program in Connecticut, long-term might mean, you know, healthcare costs become more expensive. And that is something that's already been raised in this conversation, is the cost of healthcare. Even if you do have private insurance, the co-pays, et cetera. But programs like the Title X program is a direct attack on the LGBTQ plus community, because a lot of people rely on, you know, essential community healthcare providers like Planned Parenthood to access, you know, affordable sexual and reproductive healthcare. So, you know, I just wanted to lift that up, and there's a long list of all the threats that are coming from and attacks on our rights from the Trump-Pence administration. So I'll pause to see if anyone else has more to add.
I mean, I would say this. Alex and I are old enough to remember what it was like before. I mean, so, and I'm not, this isn't casting judgment on anybody, but I feel, you know, we're of the age of, you know, Bush, Reagan, and becoming HIV positive in the 80s, and having, you know, basically you're just gonna die. So, you know, kind of, nobody cared, and it was just gays dying, so it didn't matter. And you know, so it's interesting to me. So the way that we treat the way that we were activists at that time was a much more. So there was a version, like I was in the like East Coast version, and then there was like a West Coast version that was like, you know, a much more soft version. The East Coast version was a like chain yourself to the building, like throw shit all over the place kind of activism. And, you know, I call it, we got Obama'd. Like the queer people got very comfortable in the 8 years that Obama was the president, and we were making all of these like moves forward. And then when nobody could have predicted that Trump was going to get elected, and we had sort of like backed off on our activism, and then all of a sudden we had to like, it was like the worst case scenario. It was like the perfect storm. Like we had let kind of loose a gay marriage and blah, blah, blah. And, you know, like, so it's, and then we get a president who puts 2 justices on who are conservatives, right? So it, you know, I think I am one. And, you know, I mean, you get to be at a certain level in a profession where you're not allowed to chain yourself to the building anymore, or else, you get trouble. But like, I feel like some of the racial the protesting that's going on racially right now is the way that we protested AIDS back in the 80s, and we protested the governments then. And that's why to me, it's very similar. And I just think we, as activists, if we want real health equality, and I really leave this to the younger people, like Instagram and Facebook are great, but like there needs to be an action that is like, that the people who are making the decisions are like, they have to see you there. And so I think that's why all of these protests that are happening right now are like a great example of how equity occurs, because people see people as people. Like they're forced to see the people who are being affected by what is going on in the country. And that's what happened with ACT UP. That's what we did. We forced them to see people dying. We forced them to see like what was happening to us, because they wouldn't have paid attention otherwise. And so like equity for me, it goes from like writing a paper on like how to take care of trans patients to that other side. And I think we need a little more, in my opinion, we need a little more of that side right now in the with the Trump-Pence people, because Planned Parenthood, to me, if the way that Planned Parenthood has been attacked by this administration is just like, it is unfathomable to me. And I've talked to people at the Federation, like it's unfathomable to me that why they picked like the lowest hanging fruit for the conservatives to go after. That's who Trump picked. And Planned Parenthood and transgender people are the low hanging fruit. Like they're the ones that like, that he can appease his conservatives. Nobody else, and a lot of people don't care. And so I feel for me, we need a little more of what's the protesting that's going on right now. So I'm glad it's happening. That's kind of.
So one thing I add with that is one is I'm 69 years old. So if you're going to add people to the ages list, I'm in the ages list. But anyway, one of the, I guess two things. One thing, because you're right, people sort of with Obama got very passive. And it drove me nuts because I was very active in the anti-war movement. Where the heck was the anti-war movement during Obama? I remember seeing a sign out on West Hartford lawns having a peace sign with Obama around it. Obama was not the peace president, not in the least. No president is the peace president. And we have to be careful because we are now seeing the worst of a presidency. What we can't go for, and we didn't go with Bernie, not to say I'm for Bernie or anything else, but we went with a moderate. And that's the trouble, is we stick with moderation, and we're going to see something so horrible. Well, we'll be happy with moderation, but we can't. And just from my side is, when Obama administration came out, a group of us created Queers Without Borders. Because I remember in one protest, people said, "Oh, I thought you guys only cared about marriage." And we said, "No, we didn't. There's a lot of things we care about." And that's why Queers Without Borders basically says there's health issues, which we're talking about here. There's so many issues we need to get involved. And so, but I will say one thing about it is, it drove me nuts when I was in a meeting with young folks, and the older folks told the young folks how to behave. And we aren't doing that here. What's important is we're leading from behind, that we need the younger generation to own the streets. And we are there leading from behind. We're not telling them how to do it. Just like Zinn and Ella Baker did with SNCC. When they helped form SNCC, and what they did is they basically said, we'll bring you all together at a university campus to talk. Talk about what you want. What do you want it to be? Not saying, this is how we did it. And so I think that, so as we mobilize, we need, and I think we got great mobilization today. What scares me is Trump's going to be out of the presidency, and it's going to be we're going to have, hopefully it's out of the presidency. And we're going to have, somebody like a moderate president, and everybody's going to get off the streets. But with Black Lives Matter, I'm not convinced that'll happen. But I hope it doesn't. But anyway, I'm blabbing on now, so I'll be quiet.
I think, yeah, definitely. When I went to the protest in New Haven, I wore my old ACT UP t-shirt that silence equals death, because to me, that just reflects what's going on now in terms of what's going on now. And that in Connecticut, I'm not sure if we fell asleep. I remember when Obama came out with the National AIDS Strategy and created the first AIDS office. I could cry now just thinking about it. So I went to the Connecticut HIV Planning Consortium, which is in charge of care and protection, say, hey, let's change our charter. I was a charter advisor to match this strategy. And they literally laughed at me, said, this is never going to happen. So that was about 8 years ago. And I do think the programs like Medicaid are really good and Husky. Unfortunately, if you're under 50, it's cool. But once you get over 50, the state is entitled to your assets. You know, you still have to pay that back. So those programs are so great, will create intergenerational poverty. And living in the New Haven area, I'm usually the minority in most of the consumer groups I go to. In fact, usually I'm the only Caucasian in the room. But the main thing about those rooms is everybody has a very like mind and like consciousness. It's very unified because we're in the same survival trench. And I think there's this assumption that people want to stay in that tract, or their children want to stay in that tract of being below 300% of the poverty level. So we need to create programs that help elevate people and empower them in ways that will allow them to be able to purchase a house, live a life. So in HIV, you not only need medications, but you need a really good doctor who can monitor the side effects, and you need supportive services like housing, mental health, nutrition. There's a whole lot involved with surviving HIV/AIDS. I remember in 1998, I started a campaign for anal paps, which were not being done in Connecticut. So anal paps are ways of detecting cancer, and they're really important for men and women. And it's a standard of care in Callan Lord. When I went to Callan Lord, I was floored. It's New York City, about the services. They're very holistic and very thorough. Another thing you cannot find in Connecticut is high resolution endoscopies that are outpatient. They just don't exist. If you wanted one, you'd have to go to Yale and pay a lot of money for an emergency room with anesthesia. I did that once, I'll never do it again. Now I have to go to the Bronx to have my high resolution endoscopies. Which reminds me of growing up in Long Island, when I first started going to STD clinics in the beginning of the crisis. They put up their plexiglass walls in the STD department and told me to go to New York City where the homosexuals go, you know? And that's kind of like the feeling I'm getting now, is like, we need to create these services here and create programs and look at our existing programs and figure out how we can elevate them so we can elevate people out of cycles of poverty and really address the issues that we need to address.
I love that you brought up some of the other services available in Connecticut for somebody who's HIV positive, where, you know, you can get connected with housing, you can get connected with people to help you find mental health providers. And the reasons they do these things are those attempts, right, to get rid of this intergenerational cycle of poverty and suffering. And what a lot of people, a lot of cisgender people in particular, don't understand is that for trans people, healthcare, it's not just going to the doctor and getting a physical, it's a lifeline. You know, we launched our case management program back in January, and up until now, I've received about 200 referrals. And these are people that were not seeking services elsewhere. They didn't come to us because they were homeless. They came to us because they needed their lab work to be reviewed. And in that process, we find out you've been living in a car for the past 3 weeks. You're in an abusive relationship. You're struggling with addiction. You know, you haven't had your psychiatric medications for the past 3 months, and you keep ending up in inpatient, and you can't afford the medication, and you need somebody to help you get your insurance back and active. And people in the state don't realize that there are individuals who will help you to do all of these things, but they don't know where to go. They don't know how to get connected to services. The state of Connecticut says call 211. And the resistance that I see, especially from our young LGBTQ population, to calling 211, it's like I have to beg them to do it. And that's the only way that somebody can get connected to housing in the state of Connecticut, because they changed it recently. If you're homeless in Connecticut, you can't just go to a shelter. You can't just go to an agency or an organization that helps people who are homeless. You have to start with 211. And if you don't do that, you're just not getting help. You're not getting services. So it's also these ways that the state cripples us. And we've seen from the past helping people living with HIV that when we come together as a community and we have these community-based organizations that offer these other services, these case management services, we can start to end some of those vicious cycles. But if we don't have the people doing it, and there are some people, and I know that we're all losing our minds, especially with COVID-19, because the demand for these services got like crazy overnight. And there are so few people doing the work and so many people that need these services. And if people in the community want to know how they can help, it's teaching yourself how to help people with things like this. How does somebody apply for insurance? How does somebody apply for food stamps? What does somebody do if they don't have a place to stay tonight? And in the healthcare community, I think that as LGBTQ people, we've gotten really good at addressing those things, identifying people with these needs. But for all the people that aren't connected to care, they might never see those services. And if we constantly have this fear mongering from the federal government that will make you afraid to go seek out healthcare services, that person might never get any of these other services, and thus begins the cycle anew, right? So
it's interesting also, like what it all goes together, but to what Alex said, there was a paper published recently from Germany that they want to add a fourth 90 to the, you know, the anti-epidemic sort of strategy, 90 because like 90, it shouldn't end with viral suppression. The last 90 is like quality of life for somebody with HIV, because, you know, most healthcare providers leave it like at the, like, you're virally suppressed, bye, right? Like, good for you, take your medicines, good luck. Like, and you know, as people age with HIV, it's hard, especially if you've been positive for a long time, right? Like, the shit goes downhill quick. I mean, so, you know, I think they are in this paper, and at Gilead, we are going to be very much focusing on that fourth 90 now, like to how to help provide help communities and providers and like your community liaisons to come and talk to your staff, to like how to provide the services that are required to get to that like fourth 90, to make sure that you're just virally suppressed, but like that your quality of life is one that is like, you can get health and you can get life insurance. Because, you know, it's stupid that you can't get life insurance anymore if you're HIV positive, even though like a diabetic could get, I mean, HIV is easier to control than diabetes, and diabetic can get life insurance, but if you're HIV positive, you can't, right? Like, so that fourth 90 is applicable to all the groups in the LGBTQ community, but I think there's this movement now in medicine, and it started with HIV. And HIV, by the way, revolutionized medicine and more than any disease ever has. And so like this sort of like fourth 90 of how do we live a quality of life? Like, it's not just like, I got my hormones and like, there you go, like your hormones, and you got your vaginoplasty, bye, you know. So there is something beyond it, because we've had a lifetime of trauma that we now have to overcome to live that fourth 90 in a good quality of life. And medicine has not gotten to that place, or maybe we're just starting to get to that place where we're looking at like, oh, like these people are still miserable, right? Like shit's not going right still. So I look forward to that like fourth 90 in all aspects of medicine, like that kind of like, okay, like your disease or your gender is affirmed, your transition is going on, but like how's your life, right? Like how's your life doing? And those are the hardest ones to do too, by the way. So I'm glad I'm old, because that'll leave the young people to have to do all that. And I just had to like make sure we got HIV medicines and hormones right. So.
Now, you raise a good point about quality of life too. And I just, from a personal story, is I have stage 4 cancer. But I've been 3 years into it, so thank God I've made it so far. But I worry. I'm on severe chemotherapy. I have no quality of life. I mean, but that's not from what you're saying. What I'm more worried about is, one, I've been in the hospital. I've been in the hospital. Hospital is good for trans folks, but you get the night staff in, and they have no concept of gender identity. And I never know, I mean, they treat me like shit. I won't say they treat me like shit, but they treat you pretty poorly and stuff. But also what worries me is, I'm old. Do I end up in a nursing home? How are they going to treat me? Or if I have to say I have Alzheimer's, oh my God, you know what they're going to do. If I have Alzheimer's, you know what the hell they're going to do to me. They're going to strip me down to my bare necessities of being a man. And, and it just scares me to death and things. And so, quality of life, I think, is a very important part. We focus on all the root causes, but we have to follow up, as you say, AC, on really how do we assure qualities of life throughout the spectrum.
I often say there's a different, if people are familiar with Maslow's hierarchy, and it's that triangle, that pyramid, and the top is self-actualization, and all the things on the bottom are the necessities you need to live. So at the very basic, it's like food, shelter, water. And as you get the basics, you move up to self-actualization. I always say it's different for trans people. We have our own different Maslow's hierarchy entirely. And that's what a lot of healthcare providers don't understand. And towards the bottom of that can be dysphoria. I can't tell you how many people we see that come through the clinic doors that have like diabetes out of control. They have a thyroid disorder and it's not managed at all, but they come through our doors because they're focused on alleviating the dysphoria. And until that's addressed, they're not going to be interested in addressing any of those other things. And that's what especially hospital workers don't understand, that when a trans person is there for something like what you're experiencing, if you have cancer, they're focused on that. But if you're a trans person and you're being misgendered constantly and made to feel awful and your gender is not being affirmed, honestly, the stage 4 cancer is probably not even the thing on the top of your mind in that moment. You're probably focused on being trans and just trying to exist that way. And it's time that we do more than just survive. It's time that we look at ways that we can help people in the LGBTQ community thrive, because just surviving and just being at this baseline, it's not working anymore. It's time for things to change.
Yeah, that's definitely not equity, right? Like surviving and like not killing yourself and like having like bare bones medicine and bare bones services and like a handful of providers who are good, like that's not equity. Like equity is, an HIV positive person being, I literally have had patients referred to me that like their HIV has been controlled for decades, and they go to a doctor and they're like, oh, I can't possibly like take care of an HIV patient, it's or syphilis even, like I can't treat syphilis, So equity really has to start in the education realm for medicine to like some people, Gretchen needs to work on the policy. Like I need to keep working on like the training of medical education, like to recognize like that. My friend Dimitri calls it the AIDS box. Like if you're a gay man, like you're in the AIDS box, and like you couldn't possibly have anything else wrong with you except for like you're automatically like in the AIDS box. So equity is that you like across the board we get services that are equivalent to, well, I'm not sure who the like standard should be really in that, because like African American people of color, they don't get the same services. I'm not really sure who the standard is, right? If you live in Woodbridge and you like have I don't know, like you have a Volvo, like I don't know what the standard is supposed to be, but like I know what isn't the standard, and pretty much all marginalized population do not get the standard simply because the providers aren't ready to take care of them, like at all.
Well, I think that AC set me up for what I'm going to take into our kind of last trend of conversation, which is where do we go from here? Where do we look forward? How do we start to get to the place, AC, that the person from Woodbridge that drives the the Volvo gets, how do we start to find that place of equity?
Burn it all down and start it all over. No.
I mean, I think that we need to focus on these advocates in the community, like all the people here, right, in this panel. And I see a bunch of names that I recognize too, like of people that have been in the audience. Like, it's us putting time, energy, and money into these individuals, to the community-based organizations. Like, Yale doesn't need to be getting our money, because if they could be treating LGBTQ people well in terms of healthcare, they would already be doing it by now. You know, we don't need to be giving Yale our money and our time. We need to be focused on these community-based organizations. We need to look at the Pride Centers. We need to look at the little nonprofit health clinics, the people that are actually setting that precedent, setting the standard for what LGBTQ healthcare is supposed to be, not just this base survival, not you know, whatever it is that they do at Yale when you come in and all they focus on are the hormones. We need to focus on what it is to survive and thrive, who are the organizations and the people that are already working towards that, and how can we support those places and those people to continue to do that work and to grow and expand.
I'll just say that's well said, Layne. I was struggling with an answer to it, and you really sort of hit the nail on the head, is that, you know, no one understands our communities except ourselves. We really do. And, you know, and we have a lot of organizations, we just need to build more. What scares me to death is, we see with COVID, a lot of small businesses are going to go out of business. And what I brought up with Linda Estabrook is, how many of the LGBTQ organizations are going to fall because of this? And we want to grow them, but we're afraid, and we're struggling with, how do we do fundraising now? I mean, the Health Collective, we usually have one big event. How do we do that? Are we going to have enough money? Because we're running, you know, we're running a negative at the moment to try to do that. I'm sure it's common with everyone. But I agree with you. But the key is, we got to get the community to support the community. We need our allies. I know when I first started trans advocacy, I couldn't get trans people out. You know, it was like maybe one trans person who came out with me. But the allies were there. People like Gretchen, they were there, right at Amy Miller. They were all there working with us, and great. And somehow, and I call it a coalition for a reason, because we were a coalition of organizations. So I'm just going upon your wise words, Layne, is that we do need to continue our coalition building. And we as a community are the ones who are going to help ourselves. Just as you see in the African-American community, they're taking Black Lives Matter into the streets for themselves. Marriage isn't the end of all this crap. No. Some people are going to go fat and happy off to their marriage and things, but we who know what the struggle is need to continue this fight. And so I just want to compliment you in the comments.
I mean, I think what Gretchen, and I mean, I haven't been to one of the meetings because I'm not like, I'm supposed to come, but I'm not sure I'm really allowed to come. But to that, I think that statewide coalition can be an interesting beginning to look at like where services are done well, where services aren't done well, who needs more services, you know, like what parts of the state get better services. I mean, ultimately, my vision, which I know will never work because unfortunately the LGBT healthcare organizations that exist in Connecticut are extremely like siloed organizations, and they don't like collaborate with each other. It is a like competitive kind of atmosphere, and even some of the like, you know, even some of the like community-based organizations, there tends to be this like competitive atmosphere that goes on between them. The ASOs, there's competition. And like, I don't know how that happened for us, like, because, you know, especially like now, like this is like during Trump, like I feel like we all should have come together. Like this was the time that we really needed to like pull in the ranks and like really all work together. I mean, I my vision always for how this would work would be that, you know, the LGBT health organizations would like all sort of like come together and have like satellites in different parts of the state. And like, so there would be something in Hartford, something in New London, something in, you know, and we all worked together to like make sure that each part of the state had had access to competent providers for queer medicine. I mean, I work for a pharmaceutical company now, though, so that's up to you all to figure it out. So, you know, I mean, I think that was my original goal, was to have a site in Stamford, New Haven, and Hartford, and so, you know, it can happen. People just have to start getting along better, and I think not everybody gets along. And I don't know how to make that happen. I don't know if we all need to do a Berkman like exam together to like figure out how to work with each other, but like personality tests, whatever. But if we could work better together, I think, and stop this whole like competition nonsense, especially like in the queer organizations, right? Like the ones who are run by queer people, because they will come and take it from us. They will try to take it from, and like, I'm speaking from experience right now. So we need to be together. And I don't know how to make that happen. So Patrick, maybe you can be the person who does make it all happen.
I'll try my best.
This is what happens when there's so much work that needs to be done and there's not enough money being put into it. We're all competing for the same grants. You know,
well,
like,
that's just it. I think that we're competing for grants from the feds, but the state is not putting a dime towards HIV prevention and care.
Exactly.
Either the city of New Haven or the state of Connecticut. New York achieved 90-90-90 because they had leadership and they put money towards it. Virginia had a waiting list for the drug medications, and an African-American woman named Kimberly Scott took the drug rebates from the AIDS drugs and the Medicaid expansion dollars, put them back into programs. Now they have a 500% poverty level holistic care system. So we should look at best examples and hold people accountable. So accountability is greatly lacking. New Haven and Fairfield County just got $214,000 for COVID relief money that was announced April 15th. And like, where is this money? Hartford got $200,000. The state of Connecticut got $200,000 for HIV people for COVID relief. The AECT, which is the education program piece of the Ryan White Care Act, got $400,000 for COVID relief for people with HIV. That was announced April 15th. So what's happening? Why is there's no accountability? There's no we've lost our transparency.
This is Gretchen again, and I think I'm curious for us to all continue this conversation after this this discussion, because I think that is what is kind of the intention, I think, and the hope of the Health and Human Services Network, is that this would be a network of service organizations that are like really collaboratively, and I'm saying that as someone that works for a large nonprofit, so I understand that there's always that competition, but that the network has the opportunity to bring the service providers together to better inform what we need to do next to address the unmet needs of our community. So, so I think having people around that table is going to be really critical, especially as we're having this conversation around the funding needs and what isn't being, invested into our community. And that's where this is really a helpful conversation for me as a policy advocate on how I can better advocate at the state level for policies that will improve healthcare, the healthcare needs of our community, but kind of get at some of the larger root causes, as I brought up at the beginning, thinking about, that we really have to address racism within our healthcare system. And, that far too long, this is a conversation that doesn't happen on the policy level at all. It does in pockets, but not leading to true policy reform. So I'm curious to what we can build as this network grows as well. I also wanted to put a quick plug in for the importance of the census and the need for ensuring that our community is filling out the census. Although LGBTQ plus folks aren't identified because there's not an explicit question on gender identity or sexual identity on the census, I think what we need to be doing is advocating for our community to make sure that they fill out their census because we know that we are part of the historically undercounted communities on the census, and that is a big part of how federal dollars are allocated, whether it's from healthcare to schools. That we need to make sure that our community is counted, even though we're not identified on the census. So I just wanted to put a plug in to make sure that folks are continuing to ensure that our community is filling out the census because we have every 10 years and to do this, and those dollars are what go into the programs that help address inequity within our community.
And when you go back to your organizations, the telehealth thing needs to keep going because the model of medicine is wrong when it comes to trying to to provide equity for people of color, low socioeconomics, LGBTQ people, because the model is this sort of like, we come to, like, I show up in my office and I wait for you. And if you don't get there, you get a strike. And then I don't refill your medicines. And then if you don't get your labs, you get your second strike. And then if you don't show up for your third appointment, and by the way, I've stigmatized you already as like a non-compliant patient, those first two strikes. And then the third strike, like, you're out of healthcare altogether. So telehealth really can provide a tremendous change to that, that model of medicine has not worked for our communities. And so, like, lowering the barrier, yes, there are issues that still need to be worked out with telehealth, like access to stable internet and stuff. But like, if it is going to lowers the barrier to healthcare. It definitely does. And I'm so interested to see, like, if I was arguing for policy, that would be one of the ones that I would argue without, like, I would chain myself to CMS to make sure that, like, they don't change the laws around again about telehealth visits. Because the minute they do, United Healthcare will, and Anthem will, and everybody will. United Healthcare is already threatening to do it. They said they're only going to do it till the end of September. So, I think that is going to be a huge change if we can keep that going. Huge change.
Sorry, I was having an issue with my unmute button. So I wanted to give everybody one last opportunity before we end to, and AC, you kind of probably already did this with your last, but I just wanted to give everyone one last opportunity to talk about anything that maybe they didn't get to as they're preparing today, as we have a couple minutes left. So I'm going to do the names again, and I'm going to go in the same order I went the first time. So hopefully you remember your order. If not, it doesn't matter. I'm still going to say your name. So Layne, you get to go first with closing thoughts.
Great. So it was a really good conversation. I'm really glad we all came together and did this. I think that it was hopefully educational for the audience, but I think it was also enlightening for everyone here, addressing the fact that we often do work in these silos and, the lack of funding, but the intense amount of need creates this unnecessary competition amongst us. And that's problematic, because especially as a community, especially right now when we're under attack in such a direct and hateful way, we need to be working collectively to ensure that our community is doing more than surviving, that we're thriving, that we understand the needs across the board, that someone my age understands the needs of somebody in their 70s who's LGBTQ, who's often invisible and might not be involved with the community the way that somebody in their 20s might be, that people understand there are still people living with HIV that have needs, that people understand there are still a crazy amount of homeless trans people in our state that have needs. And these might not be the people you see at the community events that you're used to going to. I think we see a lot of the same faces all the time. And that just speaks to that there are these pockets of the community that need us, that need to be brought into the circle, that are not there. And it's our job to do that. And I wanted to bring up one other thing. Patrick, maybe you can speak about it too. We talked about having a call to action for people watching this today, so that it's an active participation, and that the people watching, clearly you care about equity in healthcare because you're watching. So I know that you already care. We wanted to have an opportunity for people to participate. And so there is a letter drafted for Governor Lamont asking him to make a statement reaffirming LGBTQ healthcare equality for the state of Connecticut in light of this federal decision and announcement that LGBTQ people can be barred from accessing healthcare. So I'm not sure how you want to share that letter for people to sign, but sign it. Because we do have the protections in the state, and we need the most vulnerable people in the state to know that we have these protections, and that our state is committed to ensuring that LGBTQ people still have equal access to healthcare, regardless of what happens at the federal level.
Thank you, Layne, for bringing that up. I was going to have you talk about that at the end, but we can do it now. So yes, Layne actually was the person who approached us for the week of action. We've been doing different action items every day, and we actually hadn't set an item action for today, so this is perfect. But yes, as Layne mentioned, we have drafted the letter, and we're going to share it across our social media platforms, as well as have it on our website, hopefully by tomorrow. Just getting all the technical pieces going takes a minute, but please do that action along with many of our other actions this week that include separate communications to the governor in support of trans athletes, include signing up to volunteer for SWAN, include signing petitions to cancel rent, and a few other action items. And with that, I'm going to let Gretchen do her final words.
Well, I don't really, I mean, Layne just did such a beautiful job of closing, so I don't really know much more what I can add other than what I've already reiterated about Planned Parenthood's mission. So for folks that don't know, I think our vision is a world where every person, regardless of who they are, their gender identity expression, sexual orientation, immigration status, race, can access expert and compassionate sexual and reproductive health care. And I think I want folks to know that we're continuing to fight to ensure that people, regardless of their ability to pay, can continue to get health care at our health centers through telehealth and in-person visits for the full range of healthcare needs, including primary care, which I didn't say up front. So I just wanted to let folks know too that we are expanding into primary care at some of our health centers. And I think that's really important for people that are in our community that are, again, sometimes rely on essential community healthcare providers like Planned Parenthood to access affordable healthcare. And so, I already put my plug in for the census. The last plug I will put in is that, our voices are from our community, specifically trans people, are underrepresented in our government. That is a huge problem when we're thinking about, why we are facing such big health inequities in our state and across this country, is that we need more representation in government. And so I'm going to put a plug in to vote, but also, for folks that know people that might not know that running for office will actually impact our community in more ways than you can ever imagine. We do not have enough representation in our state government. And so we want to make sure that we're getting people registered to vote from our community and getting out to vote, and also electing people from our community. Right now we have no trans people in our state legislature. And that is terrifying when we think about how many bills are introduced each session and passed, and underrepresentation in our state and city governments is critical to addressing some of the issues we brought up today and how they impact our community.
Thank you, Gretchen. Alex?
Sure. Thank you so much for allowing me to do this today. So much comes to mind. First, I would say for everybody out there, male, female, gender, whatever, make sure you do get an anal pap, and make sure that you do a cervical pap, and or you're getting good health care. It'd be nice to see as commission that we have an ombudsman specifically for this. So if we do feel discrimination or lack of resources, we have somebody to go to and help work with this in a demonstrative, real way. Continue to support the Black Lives Matter movement. Black lives do matter, and we do have a history of systemic racism in Connecticut that's affecting policies. People are horrified that 1 out of 2 young MSM of colors are at risk of HIV. Well, how did this happen? This didn't happen overnight. We have to look at those policies that created this over time and lack of action. And lastly, I'm going to say what it all comes down to is self-worth. Know that you are worthy of a good life and good health. Learning to love yourself is the place to start, to be able to love and take care of yourself, to get the care that you need, and also to take care of others. I think the biggest take-home message for me has always been, we do have to take care of each other, but it has to start with us first. And thanks to places like the Pride Center, we can make that happen in a very real way. So continue that journey of discovering yourself and not being afraid of who you really are.
Thank you so much, Alex. Jerimarie, you are our next person.
Okay, and just real quick, and I'll sort of add on with what Alexander said, is that Black lives do matter, and importantly, Black trans lives matter. I mean, anybody who follows the Day of Remembrance knows that most of the people murdered from back when I first started the first Transgender Day of Remembrance in Connecticut back in 2002, I think it was. You know, they've always been people of color. And that's just the tip of a goddamn iceberg. And the key thing, and also just if you look at HIV in the trans community, who has the highest case of incidence? It's Black trans folks. So it's, you know, and many of the issues, many of the equity issues, they really are, you know, trans is usually at the bottom of the totem pole to begin with. And usually Black trans folks are down even below all that. And so it's just something from an equity viewpoint, we have to keep reminding ourselves of that. We all, you know, it can't be, you know, my oppression's greater than your oppression. We can't go there, but we do need to recognize that, you know, all lives matter, but Black trans lives, Black lives matter. And so I agree with you on that, Alexander. And there's really not much I can add. I know the Health Collective has actively been doing telemedicine, telehealth, and they plan to keep doing that. So I agree with that. That's a very important way to access, and I know Linda's seen a lot of the benefits of that. So I think we'll be continuing that on. But this has been a great panel. Thank you, Patrick, and all the panelists and all the attendees for coming, having patience with us through all this. And hopefully, we talk about calls for actions. One is, we keep remembering the Transgender Day Remembrance, but where's our call to action? We have to have a call to action, because just remembering all those people who died. And the key thing is, what's the root cause of the deaths? And we know a lot of them are sex workers. A lot of them are poor. A lot of them are people of color. And what are we doing in Connecticut as a call to action to stop that? We've had only a few murders. We had one in New Haven back in mid-2000s. She was burnt to death in an apartment. They finally caught the murderer. And we had one back in also a trans man who was murdered. And there's a number that we don't know about that happened. But we do, so it happens even here in Connecticut. So we do need to call to action. I'll stop there. It's just been a great thing. I hope this is a call to action too, and we do more of these, Patrick. I think, you know, we can't do just talk. We have to have action, but we should continuing this dialogue. I found it highly beneficial. Thank you.
Thank you, Jerimarie. And AC, we're going to give you the final word.
I think everybody has said what I would say. So as I've gotten older, I have gotten far less worried about calling it out when I see it. And I think the pacification of and sort of like this political correctness and that happens, sometimes we don't call out discrimination, and we don't call out bigotry, and we don't call out transphobia and homophobia, and we just kind of let it happen. And when we just let it happen, when we just let it happen, that's how it just keeps happening, right? So it feels good to me that at least I'm seeing people call out like like racism and tearing down like the statues and doing that kind of shit, because like stigma, right? Like where it's a top down thing, right? And so if we have to erase that top message for that little trans kid that like he's not okay, that's coming from like yahoo.com, right? Like, so calling out that stuff I think is like so important. And in medicine there is no room for it. If your provider doesn't want to take care of you, I don't care what the law says. When you signed up to be a healthcare provider, there was no box that said like, oh, well, I'm going to take care of all of these people. The Hippocratic Oath does not say like, do no harm except to trans people. Like it doesn't say any of that shit, right? Like, so like morality, like I think continue to call it out and activate. We have to be activists in whatever way we are activists, but my opinion is Facebook activism is not going to solve like the problems that we have right now. So they need to see us, they need to hear us, they need to make sure that they know what they're doing is wrong and that they can't treat us like that anymore. And just keep fighting the fight. But this is so much. We've come quite a long way, but we got to keep going. And so, equity is something that is fought for in this country. Period. That's just how it is. If you're different. So luckily we have panels like this and all you guys working so hard to fight for it. Gilead is doing that, and Gilead is fighting for inclusion. We are, that's part of our sort of one of our core beliefs is inclusion. And if I as a medical scientist do not do inclusion as part of my job, I'm not doing my job right. So just keep fighting. Fight whatever way you're gonna fight.
Thank you, AC, and thank you everybody for being. Thank you everybody for being the amazing experts that you are and being part of today's conversation. As far as myself and the Pride Center is concerned, this is step one in what is going to be a journey of exploring equity and fighting for equity, and hopefully someday getting closer to equity. And hopefully someday it's not, in 2 or 3 decades, but it's this year, it's next year, and it's something that we continue to work forward for. Again, thank you everybody for joining us for the Week of Action. Again, this was our panel, Equity in Healthcare for the Queer Community. If you have nothing to do in 30 minutes, our next conversation is going to start off. We have another round of amazing experts to talk about racism and combating racism in the queer community. So that's going to be, I'm sure, a very interesting conversation. We have folks from all over the state participating, and we are looking forward to that in about 30 minutes. Again, thank you all for being here. If you have any questions or looking for any more information about the New Haven Pride Center, we do just a quick trip to newhavenpridecenter.org. Again, thank you so much, Layne, Gretchen, Alex, Jerimarie, and AC. Having you here sharing space has been phenomenal.
Thank you, Patrick.
Bye, y'all.
Bye.
Thank you so much.